Get your hands off him. You're just a nurse. A senior doctor's voice boomed across the trauma bay, vibrating with arrogance. Behind him, a group of residents began to snicker. Step back, Emma. Don't embarrass yourself. She stood perfectly still, her face a mask of calm. On the bed, the patient was convulsing. The monitor shrieked, a chaotic, rapid rhythm. His heart rate was crashing. Someone do something! The doctors scrambled, but they were missing it. Emma stepped forward again. His airway is collapsing. Enough. The doctor shoved her hand away. 1 second, 2 seconds. Then the patient's eyes snapped open. He looked directly at Emma and saluted. The St. Jude Medical Center in Boston was a fortress of modern medicine. It was a sprawling labyrinth of white halls, humming machines, and high-pressure environments that never saw the light of day. But the true heart of the beast was the emergency room. It was a place where the air was thick with the scent of industrial antiseptic and the constant rhythmic wail of sirens. It was a world that never slept, a place where time was measured in heartbeats and cubic centimeters of blood. For those who worked the night shift, it was a baptism of fire every single evening. In the middle of this organized chaos worked Emma Carter. Emma was 28 years old, and to the casual observer, she was just another face in a sea of blue scrub tops. She had recently transferred to the ER from a quiet suburban clinic, and that label, the new nurse, clung to her like a shadow she couldn't outrun. Emma didn't talk much in the break room. She didn't participate in the late-night gossip sessions about which doctor was dating which resident. She didn't try to impress the senior staff by dropping complex medical jargon into every sentence. She simply worked. Emma chose the night shift deliberately. It was the shift most people avoided because it was the time when the most desperate, messy, and violent cases arrived. She moved through the trauma bays with a quiet, economical grace that was almost invisible to the naked eye. While other nurses were still rushing to find the right drawer for surgical gauze, Emma already had the tray prepped and the suction running. She had a rare habit of observing the entire room, not just her assigned task. She was constantly scanning for the smallest changes in a patient's breathing, the subtle twitch of a finger, or the graying tint of skin that signaled a crash was coming. However, her thoroughness was consistently mistaken for hesitation by her superiors. Her silence was viewed as a lack of clinical knowledge. The senior attending physician, Dr. Harrison, was a man who let his 20 years of experience harden into a wall of arrogance. His ego was so large it seemed to fill the trauma bay, leaving little room for anyone else's input. He saw Emma Carter as a liability, a civilian who hadn't yet been hardened by the real world of high-speed trauma surgery. He treated her like an intern who barely knew how to take a pulse. Nurse Carter, Dr. Harrison would often bark without looking up from his tablet. Just stick to the basic vitals and stay out of the way of the real doctors. This isn't a classroom project. This is a battle. And I don't have time to teach you the basics. Emma would simply nod, her expression unreadable. She didn't argue. She didn't defend her credentials. She didn't tell them that she had already spent 4 years in the most hostile environments on the planet. She never mentioned that she had performed emergency field tracheotomies in the freezing mud of a mountain pass while mortar rounds exploded less than 50 yards away. She didn't share that she had been the primary medical provider for an elite special forces team for 2 tours of duty. To her colleagues, she was a blank slate, an inexperienced newcomer. To her, she was a professional who knew that in the ER, the only thing that mattered was the patient's survival, not the doctor's pride. There is a specific tragic phenomenon in the medical world, the dismissal of the veteran medic. Many former combat medics return to civilian life and find themselves buried under a mountain of red tape and ego. In the military, a medic is a godsend, the thin line between a soldier seeing his family again or coming home in a box. But in a civilian hospital, they are often seen as just another level of low-tier bureaucracy. Emma carried this weight silently every single night. She watched the senior doctors make life-altering assumptions based on their own egos, rather than cold, hard observation. She saw a system that was efficient but lacked the human touch. Every night she would perform a silent ritual. She would double-check the backup oxygen tanks, adjust the pillows for the terrified elderly patients, and watched the shadows in the corners of the hallways. She was waiting, not for praise and certainly not for recognition. She was waiting for the inevitable moment when her specialized, battle-hardened skills would be the only thing standing between a patient and the morgue. One rainy Tuesday night, the shift started with an eerie quiet. The residents were sitting at the nursing station, drinking lukewarm coffee and scrolling through their phones. The trauma bays were empty, the floors still wet from the last cleaning. But Emma felt a familiar electric prickle on the back of her neck, the same sensation she used to get in the seconds before an ambush in the desert. She didn't sit down. Instead, she began checking the intubation kits for the third time that hour. She organized the suction canisters and verified the blood types in the rapid infuser. "What are you doing now, Emma?" a fellow nurse asked with a patronizing smirk. "Preparing for a world war." "Relax, it's a slow night. Go sit down and look at some magazines." Emma didn't answer. She didn't even look up. She just tightened her ponytail, checked the seal on a sterile tray, and looked at the digital clock on the wall. At exactly 2:14 a.m., the doors of the ambulance bay didn't just open, they burst apart. The silence of the night was shattered by the sound of heavy boots running on linoleum and the panicked shouting of military police. The air in the ER changed instantly, dropping 10 degrees in perceived temperature. The storm hadn't just arrived, it had breached the walls. If you have ever seen a highly skilled person being ignored just because they were humble, unjust. "Trauma 1, clear the bay! Move, move, move!" the lead paramedic screamed as they wheeled in a gurney at a frantic pace. The wheels of the stretcher screeched against the floor, leaving a trail of dark red droplets behind. Behind the gurney followed three men who didn't look like typical hospital visitors. They were dressed in full tactical gear, their faces smeared with grease, sweat, and soot. Their expressions were grim, their eyes darting around the sterile room with a protective, predatory intensity. It was clear to everyone present that the man on that bed was not just a patient, he was their leader, and they were ready to burn the building down to keep him breathing. Dr. Harrison stepped into the bay, instantly donning his lead doctor persona. He enjoyed the theater of a high-profile case. "Vitals? Status? Talk to me now," he commanded, snapping on his gloves. "Male, 38 years old. Multiple shrapnel wounds to the lower abdomen, heavy arterial blood loss, and blunt force trauma to the chest and neck," the paramedics shouted over the piercing alarms of the portable monitors. "He's a Navy commander. We pulled him out of a catastrophic training accident at the harbor, but he's been fading fast. He lost consciousness 10 minutes ago, and his pressure is bottoming out." The patient was terrifyingly pale, his skin a sickly, translucent shade of gray that signaled his body was shutting down. His breathing was shallow, ragged, and sounded like sandpaper rubbing together. Dr. Harrison immediately began barking orders for massive blood transfusions and an emergency ultrasound of the abdomen. He was focused on the obvious, the massive blood loss. He was a master of the operating room, and his instinct told him to stop the bleeding and get the patient to the OR as quickly as possible to save the organs. Emma Carter took her position at the head of the bed, the dead man's spot, as they called it in the field. While the residents were fumbling with the difficult IV lines and Dr. Harrison was shouting about the necessity of a chest tube, Emma wasn't looking at the monitors. She was watching the patient's throat. She saw the subtle, rhythmic tugging of his neck muscles, the tracheal tug that indicates a desperate struggle for air. She heard the faint, high-pitched whistle in his exhale, a sound known as stridor. To her trained ear, it was the sound of a closing door. "Dr. Harrison," Emma said, her voice cutting through the noise, clear and disturbingly calm. "His airway is becoming compromised. There is significant internal swelling in the neck from the blunt force trauma. He needs an advanced airway now." Harrison didn't even look up from the patient's bleeding torso. He was deep in the middle of a manual compression. "He's still breathing, nurse. The monitor says 94% saturation. Focus on the pressure. He's losing volume. If we don't stop the internal bleed, the airway won't matter because he'll be a corpse. Now get more lap pads." One of the junior residents laughed nervously, trying to score points with the senior doctor. "Emma, look at the screen. He has an oxygen mask on at 15 liters. He's fine for now." Maybe read the clinical data before you try to play doctor? Emma didn't flinch. She leaned closer to the commander, her eyes locked on his neck. She could see the slight, almost imperceptible deviation of his trachea to the right side. She knew this pattern by heart. She had seen it dozens of times when a soldier took a blast from an IED. The internal bruising was expanding rapidly, and in seconds the hematoma would crush the windpipe from the inside like a soda can under a boot. The mask is providing flow, but the pipe itself is narrowing, Emma insisted, her voice gaining a sharp military edge. She stepped forward, her hand reaching for an intubation blade and a cuff tube. We need to tube him right now or we are going to lose the window. The swelling is accelerating. I said enough, Harrison roared, finally stopping his work to glare at her. His face was flushed with anger at being challenged in front of his staff and the military escort. You are a new nurse who clearly doesn't understand the hierarchy of trauma priority. You are overreacting and wasting my time. Get back to the supply closet and get me more gauze. That is an order. The group of Navy SEALs in the back of the room shifted uneasily. One of them, a man with a jagged scar across his cheek, looked at Emma, then at Harrison. They were confused by the conflict, but they were also getting desperate. They could see their commander's chest wasn't moving the way it should. Emma felt the clock ticking in her brain. It was a countdown she had heard in her head 1,000 times before. 20 seconds, 15 seconds. She looked at the monitor. The oxygen saturation, which had been a steady 94, suddenly began to plummet. 92, 90, 88. The numbers turned red and the alarm changed to a more urgent, high-pitched scream. He's crashing! Saturation is 85 and falling, a resident yelled, his voice cracking with panic. Suddenly, the commander's body began to seize. It wasn't a standard seizure. It was the death struggle of a brain deprived of oxygen. His body bucked against the restraints, his face turning a deep, terrifying shade of purple. The monitors turned into a wall of flashing red lights. Dr. Harrison finally panicked. He grabbed the laryngoscope, trying to see down the throat, but he realized too late that Emma was right. I can't see anything. The tongue is too swollen and the glottis is gone. I can't get the blade in. Harrison's voice was now high-pitched, laced with the one thing a senior surgeon should never show, pure, unadulterated fear. He had waited too long. The simple, standard procedure was now physically impossible. He had focused on the blood on the floor and ignored the breath in the lungs. The room was descending into total chaos. The SEALs were stepping forward, their hands clenching into fists as they watched their leader die because of a doctor's pride. For the first time in his career, Dr. Harrison stood paralyzed, with no plan and no way out. If you have ever seen a small mistake grow into a disaster because someone was too proud to listen, I was wrong. The trauma bay was a hurricane of noise and terror. Dr. Harrison was sweating through his surgical cap, his hands shaking so violently he dropped the metal laryngoscope blade onto the floor. Come on, damn it, why won't it go? Someone get me a smaller tube, anything. The Navy SEAL commander's heart rate was plummeting on the monitor. 40 beats per minute, 30 feet. The death rattle filled over the room, a wet, guttural sound that signaled the final stages of respiratory failure. The silence of the grave was beginning to creep into the corners of the bay, even as the machines screamed. Suddenly, the commander's eyes snapped open. He wasn't looking at the ceiling in a daze. He wasn't looking at Dr. Harrison or the frantic residents. His gaze, piercing and strangely lucid through the haze of shock, moved past the panicking doctors and landed directly on Emma Carter. She was standing at the head of the bed, her hands already prepped with a sterile scalpel she had snatched from the emergency tray the moment she saw the saturation drop. With a superhuman effort that defied medical logic, the commander's right hand moved. It was a slow, shaky movement, fighting against the gravity of his own dying body, but it was deliberate. He raised his hand to his brow, his fingers stiffening into a perfect, sharp angle. A salute. The entire trauma bay went silent. It was as if someone had hit a mute button on the world. Dr. Harrison stopped mid-breath, his mouth hanging open. The residents froze in their tracks, holding tubes and bags they didn't know what to do with. The military officers in the back let out a collective, audible gasp that sounded like a prayer. The lieutenant with the scarred face stepped forward, his voice a ragged whisper. That's, that's a commander's salute. He's not just conscious. He's recognizing her. He's giving her the field. Dr. Harrison looked at Emma, his voice trembling with a mixture of confusion and terror. Emma, do you know this man? Who is he to you? Emma didn't look at the doctor. She didn't have time for his questions or his ego anymore. She kept her eyes locked on the commander, her gaze conveying a message of, I've got you. She returned the salute with a sharp military movement of her own hand, a gesture of mutual respect forged in fire. I was his primary medic, she said. Her voice had undergone a total transformation. The soft, hesitant tone of the new nurse was gone. In its place stood the voice of a sergeant of the United States Army Special Operations Combat Medics. 6 years ago, in the Helmand province of Afghanistan, Emma continued, her voice cutting through the silence like a jagged blade. His unit was caught in a mountain ambush. He was hit by a sniper's round that shattered his jaw and neck. I held his throat open with my bare fingers for 3 hours while we waited for an extraction in the middle of a zero-visibility sandstorm. He knows exactly who I am, and he knows I am the only one in this room who knows how to save him. The lieutenant's eyes went wide with shock. You're Mitchell? The ghost of Helmand? The one the SEALs called the Angel of the Trench? We thought you had retired to the mountains and disappeared. No one knew you were working in a city hospital. The room seemed to spin for Dr. Harrison. The woman he had spent weeks mocking, the woman he had just called a naive amateur, was a legendary combat medic who had saved the most elite warriors on Earth in conditions he couldn't even fathom in his worst nightmares. He realized he had been trying to lecture a master on the basics of survival. Dr. Harrison, Emma said, her voice now commanding and devoid of emotion. You are losing him. You have 10 seconds before his heart stops from hypoxia. Move aside. Harrison didn't even attempt to argue. His ego wasn't just bruised, it was shattered into dust. He stepped back, his hands falling uselessly to his sides. What do we do? The senior attending asked, his voice cracking. The man with the 20-year career was now asking the rookie nurse for orders. Emma didn't hesitate for a microsecond. He has an atypical laryngeal edema caused by the blast pressure. Standard oral intubation is physically impossible. The swelling is too dense. We need to perform a surgical cricothyrotomy. Hand me the 6.0 tube, the number 10 blade, and the betadine. Now! Her hands were like cold steel. She didn't look at the monitors or the flashing lights. She used the tips of her fingers to feel the anatomy of the commander's neck, finding the precise, narrow spot between the thyroid and cricoid cartilage. With a single, swift, and terrifyingly precise motion, she made the horizontal incision. The blood sprayed slightly, staining her scrubs and her face, but Emma didn't flinch. She used her pinky finger to maintain the opening, inserted the tube into the trachea, and immediately hooked up the bag valve mask. Bag him, slow and steady, she commanded a stunned resident. The resident began to pump oxygen directly into the commander's lungs. Within 5 seconds, the monitor began to sing a different tune. 88, 92, 96, 99%. The terrifying blue tint vanished from the commander's face, replaced by a faint, healthy flush. His heart rate stabilized at a steady 80 beats per minute. The alarms finally went silent. Emma stood back, her scrubs soaked in blood, her breathing perfectly controlled, as if she had just finished a light walk. She looked around the room at the circle of faces. The doctors were staring at her in absolute religious awe. The Navy SEALs were standing at a rigid attention, their eyes filled with a gratitude that went beyond words. He's stable for the moment, Emma said, turning to Harrison with a professional coldness. He's ready for the OR now. You need to handle the internal abdominal bleeding immediately. But heed my warning, doctor. Make sure your anesthesiologist uses a low-pressure ventilator setting. His lungs have blast lung syndrome from the impact, and high pressure will tear the alveoli. Do you understand? Harrison just nodded, unable to find his voice. He realized that in this room, he wasn't the expert. He was just a man with a degree, while Emma Mitchell was a woman with a legacy of blood and honor. The new nurse had just saved the hospital's reputation, the commander's life, and showed every person in that building that true power doesn't need to shout to be felt. It only needs to know what to do when the world is falling apart. If you have ever owed a debt of gratitude to someone you previously looked down on, I am indebted. An hour had passed since the commander had been rushed into the operating suite. The trauma bay was now being scrubbed clean by the janitorial staff. The bright red blood was being mopped away, and the discarded plastic packaging of the life-saving tools was being cleared. The adrenaline that had fueled the room like high-octane gas was beginning to dissipate, leaving a heavy, ringing silence in its wake. Emma was at the stainless steel scrub sink, watching the pink-tinted water swirl down the drain. She was scrubbing the blood from her hands and forearms with a methodical intensity. The hot water felt good against her skin, helping to ground her back into reality. She wasn't thinking about the win or the looks of shock on the residents' faces. She was thinking about the commander at Shizdam. She was remembering the taste of dust in Afghanistan and the faces of the men she hadn't been able to bring home. A shadow fell over the sink. She looked up into the mirror and saw a doctor. Harrison standing behind her. He looked 10 years older than he had just 2 hours ago. His white coat, usually so crisp and intimidating, was draped over a chair in the corner, stained and forgotten. He stood there for a long time, just watching the water run. Finally, he spoke, his voice low and raspy. "I've spent 20 years in this hospital, Emma," Harrison said, his eyes meeting hers in the reflection. "I thought I had seen every type of emergency. I thought I knew exactly what a hero looked like. I thought I was the smartest person in any room I walked into." He took a deep, shuddering breath, his shoulders sagging under a weight he hadn't carried before. "I was wrong. Deeply, dangerously wrong. Not just about the patient's airway, but about you. I allowed my own arrogance and my title to blind me to the extraordinary talent standing right in front of me. I almost killed that man tonight because I was too proud to listen to a nurse." He walked over to her and did something that no one in the history of St. Jude Medical Center had ever seen him do. He bowed his head slightly, a gesture of genuine submission. "I'm sorry, Emma. I am truly sorry. Not just for tonight, but for every time I dismissed you since you arrived. You are more than a nurse. You are the finest medical professional I have ever had the privilege to stand beside. You didn't just save that commander. You saved my soul from carrying a mistake I could never have lived with." Emma turned off the faucet. She dried her hands slowly with a paper towel. She looked at Harrison, and for the first time she allowed a small smile to touch her lips. It wasn't a smile of triumph or, I told you so. It was a smile of deep human understanding. "It's okay, doctor," she said quietly. "In the field we have a saying, the ego is the first casualty of war. In the ER, it should be the same. The patient is breathing. That's the only apology I need. Let's just make sure it doesn't happen again." As she walked back into the main ER station, the atmosphere had undergone a total shift. The other nurses, who had once whispered about her being too slow or the clinic girl, now stood aside to let her pass, their eyes wide with a new kind of reverence. The residents who had laughed at her wouldn't even meet her eyes, staring down at their charts in a silence born of pure shame. But the most powerful moment came when the lieutenant from the SEAL team approached her in the hallway. He had been waiting by the surgical doors. He stood in the middle of the corridor, his face still covered in the grime and grease of the field. He didn't say a word. He didn't ask for her phone number or try to make small talk. He simply snapped his heels together and saluted her. The same crisp, respectful salute he would give to a 4-star general. Emma stopped. For the first time that night, she felt a lump in her throat. She stood tall, her back straight, and returned the salute. Her hand was trembling just a tiny bit this time, the emotion of the night finally catching up to her. "We'll take it from here, Sergeant Mitchell," the lieutenant said, his voice thick with emotion. "The word is already out. The teams know you're here. Thank you for bringing our brother home." Again. Emma watched them leave, their heavy boots echoing through the quiet hospital. She realized in that moment that she didn't need to hide her past anymore. She didn't need to be the new nurse who didn't know the ropes. She was Emma Carter Mitchell, and she was exactly where she was supposed to be, standing in the gap between life and death. If you believe that admitting you were wrong is the hardest but most important thing to do, I will be kind. In the weeks that followed, the story of what had happened in Trauma Bay 1 spread through the hospital like a wildfire in a dry forest. It became a legend, a cautionary tale that every new medical student and nursing intern was told on their first day. It was the story of the ghost medic and the dangers of professional arrogance. Emma Mitchell, she had gone back to using her full name on her badge, didn't change her personality. She didn't suddenly become loud or boastful. She still worked the grueling night shifts. She still moved quietly through the halls, checking on the patients who had no visitors. But she was no longer ignored. When she spoke, even in a whisper, doctors stopped talking. When she made a suggestion, it wasn't questioned. It was followed with immediate action. Dr. Harrison became a different man. The night of the commander's salute had broken something old and rigid inside him, allowing something new to grow. He started a groundbreaking training program for the senior surgical staff titled The Medic Mindset: Interdisciplinary Communication in Crisis. He used the events of that night as the primary case study, often standing in front of his peers and admitting his own failure as the starting point. He learned to listen to the nurses, the respiratory techs, and even the cleaning staff. He realized that a hospital is not a pyramid with a doctor at the top, but a complex web of lives where every strand is vital. The Navy SEAL commander survived his surgery, though the recovery was long and difficult. 2 weeks later, he was moved from the ICU to a private room overlooking the city. His first visitor wasn't a fellow officer or a family member. It was Emma. When she walked into the room, he was sitting up in bed, his neck heavily bandaged, but his eyes as sharp as broken glass. He didn't say thank you. Between people who have shared a trench, those words are often too small. He looked at her, a faint, pained smile on his face, and whispered, "I knew the moment I heard your voice in the chaos. I knew I wasn't going to die today. You always did have a way of bossing me around, Mitchell." Emma sat by his bed for over an hour. They didn't talk about medicine or surgery. They talked about the cold wind in the Hindu Kush Mountains, the sound of the ocean at the base in Coronado, and the brothers they had lost along the way. They talked about the peace they were both still trying to find in a world that felt too quiet. Emma realized that the greatest lesson of that night wasn't about her surgical skills or her military past. It was about the fundamental truth that no one is truly just anything. The person you pass in the hospital hallway might be carrying a history that would break your heart. The woman you overlook in the office might have saved a dozen lives in a previous chapter of her story. The person you laugh at because they are new might be the only one who can save you when your world starts to crash. True greatness doesn't need to be announced with a trumpet or a fancy title on a mahogany door. It is found in the quiet moments of absolute crisis. It is found in the hands that stay steady when everyone else is shaking. It is found in the heart that refuses to give up on a soul that the rest of the world has already written off. And most of all, it is found in the humility to listen. Because the smallest, quietest voice in the room might be the only one that knows the way out of the dark. Emma Mitchell walked out of the hospital that morning as the sun was beginning to rise over the Boston skyline, painting the clouds in shades of gold and purple. She felt the warmth on her face for the first time in days. She felt a deep, resonant peace in her chest. She was a nurse. She was a warrior. She was a teacher. She was Emma. And she was already looking forward to her next shift. If you believe that humility can save lives, please comment, respect, and don't forget to subscribe to SN Touching Stories for more powerful, true, and inspiring stories that touch the heart. Thank you for watching.